Hello, my dear girls. You are up for a treat today because today we are doing under-jaw massage. Under-jaw area, together with the muscles of our mastification, is a part of our deep front line. We are addressing the upper portion of it today. So make sure that you sit correctly. You're growing from the top of your head. You are not crossing your legs, especially today. And you are breathing. Your ribs go towards the side, right? Belly breathing is also good. I have nothing against it. But the lungs are here, not in your belly. So make sure that you breathe in correctly today. Pick at the ball that you have. If you don't have a ball, you're going to start with massaging your chest, and I will give you comments about what we're going to be doing today, because this is a challenging but very rewarding day if you get it. So first we're going to go up and down on your chest bone, and every time you go up, think about somebody come and here the line, and they lift your upper body, and then you drop your shoulder. They lift your upper body, you can help with your shoulders, right? And then you drop your shoulders, but your upper portion, your breast, your chest, your heart is still stays up. Up and not up means towards the front and bye-bye lower back. I don't care for my spine, I don't see it. No. Up means higher, means more space here. Let's flush it all. Let's flush it all and let's start. So up and down with the idea, if you need to do a couple times, lift your shoulders and then drop it, but don't drop this, okay? While we're massaging, press, you can press on your sternum bone, but again, press, it means from 1 to 10. Yes, 10 is where you see stars and tears in your eyes. We stop on 5, 6. That's enough, no need. Or if you go up to 10, you're gonna have opposite reaction, your body gonna be like, oh, what is she doing with me? Am I under attack? So no. We work not on the body, we work with the body. So for now, up and down. Up and down on your chest bone, especially on this region where your ribs connected. Especially go there. You see how I'm placing a second hand, because I'm ready for this more deep tissue. If for you, this is where you get, this is good. That's, you are not there yet, but it doesn't mean that you're never gonna arrive there, but you should not, and already be like, this is not where we're gonna go. Anyways, today is the intraoral technique. So clean hands, gloves, make sure that you have with them. When we do intraoral work, we are working with a mucus environment. What is mucus environment? It is definitely different from your skin. Definitely different from your skin. Definitely you cannot see even properly on the camera what I'm doing there. There is no way I can put the camera in my mouth and show you exactly. I will do my best to explain you. Don't worry. It's better to start slow. However, you need to remember that the mucus environment is prone to little cuts, and it doesn't matter if it's a self-massage or professional massage, you can, do a little micro trauma. So make sure again that you clean your teeth, that you're not gonna put anything dirty in your mouth afterwards. You should not never do it, but know that something has happened there today, and you need to protect that area. Maybe mouthwash. Make sure that you are not going too hard, because you're going to be working with the fascial structures and muscle structures there. Fascia loves slow speed. After you massaged your chest bone, you're going to go with your one hand, and now we are really going into the lifting of the chest. We are really going into the lifting of the chest and then dropping the shoulders. And again, lifting this every fascia and skin and fat to the chest. While you get to this area, I'm going to ask you to start pulling the tissue from this in between your clavicle bone. Woman who knows that they have something with thyroid, I hope you ask your doctor for the permission to do deep massage, but I would miss this technique again until you get the permission from the doctor. Some doctors said that thyroid is actually an organ that loves blood flow and needs to be addressed, and some people are very nothing there. So just be careful. You can go up to here, just this. When we are massaging, when we're trying to pull, here's usually like a little fat part here inside lips. When we're trying to pull the tissue from here, you just miss this exercise, and we're gonna leave it up here the third time. And let's go. Pull, pull, pull. You see, I'm not pinching. I'm not going like this. I'm just pulling. It's like isometric lifting of the tissue. Very famous. And I'm gonna leave it. Lift it and leave it. Now we're going back to the ball. For a change, I'm going to change the ball, and you're going to start lifting your hand slowly and massaging it. Your chest muscle connects to not up to here, it connects to up to here. So you're going to lift slowly your hand, and that will drag basically the fascia, and we will make sure that you are watering your muscle and fascia. And obviously we're already working with our with the area of our platysma, right? When we talk underjaw, we have to understand that there is a deeper structures of the underjaw, including your hyoid bone, your esophagus, your throat, and there is superficial structures, right, of your underjaw. This is your sternocleidomastoid lives right here, right? Your platysma lives right here. So they all, as deeper, like they all will be influencing how your underjaw looks. So we'll have to address all of them today. Okay, you can go up to your deltoid. Again, I'm increasing a little bit pressure. You can relax your hand. You can see what's gonna happen if you relax your hand, and then see what happens when you lift your hand very slowly. Now, a couple times we will lift our hand very slowly while just moving the ball, like it's imagining it's dragging the tissue, while we turning our head opposite direction, and you already should feel somewhat pull there. Again, here I don't want you to press with your ball because obviously there is a joint of your shoulder. Just turn your head. Turn your head. Obviously also when we talk under jaw, we also talk tongue placement. And when we talk under jaw, we talk glands. We talk glands. Today we will address our glands. A lot of people who actually have blockage in their glands know what it is. If you don't suspect that you have blockage in your glands, then means that you don't have, because you would know, you know. So sometimes it's just a stagnation near it. Now first a little pressure and lift of your hand. So going towards the side. How to say it, naked or not naked regarding here. You can do it on your skin if you, again, because it will make it red, especially if you have a ball like this, it will leave the marks. Or you can do it on something very, very tiny. However, when you do a fascial pull with a turn, I would rather you be on, would rather you be on your skin. Take it. And go this way, like that. Now the exercise, have your elbows and lift your shoulders, lower your head comfortably, keep lifting your shoulders for another 10 seconds, and then we're gonna switch our hands. If your left hand was on top of, it's gonna go to the bottom. If your right hand was on top, it's going to go to the bottom. Switch. Great. Now touch the elbows and start pulling like a side of your ribs, like basically you're tilting your body towards one side and tilting your body towards another side. Make sure that your core is engaged and your ribs are not flaring. Now slowly open your hands, and let's do the fascial stretch. So your hand is attached to your skin. You wait 1, 2, 3, and then you start lifting the upper hand towards your jawline, and towards the bone of the jawline. You're gonna arrive right towards the bone, and I want you to hang and see, without pressing into your underjaw, how much can you go inside? Like, what is your depth? Is it like half of the hand? That's probably a little unrealistic. Is it a little bit like just have a mental note, because after today's lesson, it will change. The second side, so again, I stabilize this, I contact it. This is I'll be doing skin, but I contact it. I barely, you barely see me moving because I'm moving deep. When I'm deep, there is no much outside lens happening. And then I arrived under jaw. So right here I arrived, and I hang. And I see, okay, how does it feel out there? Can I go deep, or I cannot go deep? And one more time, just for a little stretch of your platysma, and arrive here, and another one, arrive here. Tongue on the upper palate, and tongue on our lower palate. See if it changes. Since we are working with the underjaw, we would like to also work on your omohyoid. So find your trapezius and find somewhere like this is the triangle. Find somewhere here. Just place your hand here and place your hand on the hyoid bone on the side. Swallow. Somewhere here. And you're gonna turn your head away from the shoulders that you are pressing on. Pressing, not digging, so just a little bit. You're gonna turn, you're gonna still feel the hyoid bone. And imagine these two hands, they're stretching, right? They have a string that stretches. And you're gonna swallow here 3 times. Very good. Second side, again, the trapezius, you're going somewhere not here, you're going somewhere right here. Don't go too crazy, like, oh, is it here? Is it this 1 centimeter? That's not going to help you. Find the hyoid bone, that's that little flying bone, as a lot of people say. Turn your head. You can swallow and your bone will go up and down. And when you turn your head away enough, you're gonna swallow 3 times. Very, very good. Now we are going into your underjaw. So be prepared to put your gloves very soon, but first we're gonna go superficially. So this is your sternocleidomastoid. I want you to start from the top and start moving the tissue towards the bottom. Look how you place your hand like this, and you turn your hand away, like you're trying to move your sternocleidomastoid towards the back. That will never happen because sternocleidomastoid is very strong muscle. But I need you, me, and we all need open this pass, because the glands, when they are like this, we're gonna milk them, and we're gonna push the fluid. And if this is all in fibrosis, be careful. If this is all, if you know, like you're like, oh, excuse me, but I can't even find my sternocleidomastoid up to 9 days, then be very gentle. You don't want a lot of fluid being pushed, because the fluid will just be stuck somewhere. So you place your hand like you're holding the head on the back, and you're doing this. You're holding your hand, and then you're doing this, you're turning the head. We are already going into this. So right on top of your sternocleidomastoid, right on top and right on that edge. Make sure that you are not doing it like this. Second side. So I'm giving a little credit. This is a credit of the tissue, and then I take a credit back with a percentage, like any bank doing. You know, give it a little bit, and then you're like, no, actually, I changed my mind. No, just like that. Now you go in between your jawbone And right here, you're gonna put 2 hands and you're gonna start to vibrate. Vibrate. Vibrate it and just do 3 sweeps of the tissue. Find this corner and vibrate. Sweeps. Sweeps. Now let's just bring some blood to the skin of the underjaw. So you place your hand and you're going to start shred. You're gonna start shred. We had a similar exercise when we pull up a little bit from here, you can do, and then shred. And when you shred, now, since you are more confident, I want you to shred with the idea, you need to get fire. You need to get fire there. And as soon as the temperature increased, you feel increase of the temperature, you feel that the area is warm, you stop. For some people, it will take a minute. For some people, it will take 15 seconds. Depends on how much beautiful stuff we have there. So as soon as I feel, okay, there is increase of the temperature, a little redness, I stop. Somebody still can be doing this. This is great. We just need to bring blood flow. We don't want to remove too much water because we know that the skin is a little slower and we need to work on the deeper structures. Okay, now is the time. Today's lesson will be a little longer, so stick with me, please. We're going to go in our underjaw. We have the sublingual and submandibular gland. The gland is here and here. So the gland will feel different from the muscle. It's okay if you touch it. However, the massage is not for the glands. The massage is for your underjaw muscles that we just already start addressing by working on your hyoid. You're gonna have one working finger, which is going to be your outside finger. And this finger is like, imagine the magnet. This is a magnet work, right? Have you ever had the batteries with the same plus plus? You kind of like, they don't touch, but you already feel that like something is going on. This is, imagine, this is two batteries. They're going to be looking for each other. And this going to massage, this one going to press a little bit. And you're going to go right around your teeth. Right, like up and go, because the glands are, as I showed you, they're a little bit like in there between. The difference also will be, if you ever touched chicken breast, the uncooked chicken breast, that's how it feels. If you ever touched jam, pudding, mushy, porridge, that whole gland feels the same. So let's put the battery here. This one massaging, small circle, not like this. It tells me that the battery already lost each other. Up. Move your tongue up. Muscle. Let's go. Lower your head. Smaller circles are better. That's number two things that we can do to make sure that we are on the muscle. Move the tongue on the upper palate, move the tongue left, right, up and down, not press while we do massage. And what are we feeling? I apologize in advance if I talk with my hand in my mouth. Otherwise, it will be a really long video. Go here. 1, 2, 3, 4, 5. Tongue, move the tongue. I'm here. Ooh, I'm here. Great. I'm lifting my chin just for purpose for you to see. Ideally, you actually put your hands on the belly ball and you lower your chin, right? Here. Go. When you move your tongue, you will feel more trigger spots. You obviously, I feel 1 or 2 trigger spots. Those are spots that you should spend more time. And I go almost towards the end. Super good. I'm gonna change the gloves because I'm gonna work on this side. But before doing this, take your hyoid bone, take your tongue, and pull your tongue towards the camera. Pull towards the camera, towards me, straight. And while you're holding your hyoid bone, you're gonna vibrate, but you're not gonna vibrate like you're trying to dislocate your throat. You're gonna vibrate just a little bit, just to, a little drainage, a little bit like half vibration. And now you swallow in your tongue, and also vibrating. Great. And just do a little bit of motions like this to particular, let everything flow. If you touch with your tongue, both sides right now, you might feel the difference. You might even feel the difference how your tongue moves. By the way, girlfriends, again, if you need a longer time spent there, please do so. Let's go. Batteries, tongue up to make sure that you know where you are, to find those trigger spots. Relax the tongue and massage. This one is a battery. Second spot, like that. Do not go too deep not to have the gargle effect. Very good. Now the same vibration. Swallow the tongue. Now you don't have to have a glove, you can just have the tissue, please not a toilet paper, just a tissue, and we're gonna pull the tongue out and a little bit up. A trick, you can have your tongue inside of your hands and move your body away. That's the one, that's for people who can withstand it, because a lot of people have very tense tongue. Great. If you have a lot of fluid in your throat, good job. We are going to address the nerve that actually works with those glands, right? Because sometimes it's not the structure of actually it's usually at the same time, but we need to address the nerve, the computer that sends the things. And that nerve is arriving from your lateral pterygoid. Where is the lateral pterygoid? Very difficult, even for some professionals, to find. But you girls are with me. You're gonna be better than anybody. So we know. Remember, when you talk lateral pterygoid, you think about hoodie or medusa. Medusa is a place like this, right? Everybody saw the jellyfish medusa, jellyfish. Right? It's lays right there. That's jellyfish. That little bit of the hood. How are we gonna find it? If I would say, let's just try to palpate it, it will be somewhere here. But because here is the masseter, obviously it's very hard to play with your jaw to even be able to find it outside. So we're gonna go inside. You're gonna walk on your upper teeth. And then you will arrive in here. You're gonna open your jaw, and you're gonna feel like it's almost like a like a hoodie. Like you will see, like it's not the ceiling, it's like the hood, and you're gonna start really slowly, nicely touching that hoodie. When you're gonna start moving your jaw left and right, you will feel like there is something else appears. All you need to do is increase the space for at least 10%, not twice. You're not gonna have like a up to your eye opening. However, we need to work. This is a main muscle of the TMJ, and this is a main muscle of what we are doing today. So let's go. You go up, 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 up. Okay, I am here. My finger is here. Open your jaw. You feel that hoop, and just slowly. Little circles. I know a lot of people might be like, it's tensed, yes. Just a little bit. Now you're going to shift your jaw forward, and you will see what's happening with that space, and then left and right, slowly. Nothing like crazy distance, okay? Forward. Left. Right. When you move right, if you're working on the left side, you will see less space. But the idea is just to work everywhere. Imagine you're trying to make more space there, like just by pushing it a little bit towards your eye. Very nicely. You are petting it. Very good. And now you're going to find this bone. Open your jaw and close. Find your cheekbone, open your jaw and close. Right here, you see? Where's the corner? I want you to go into that corner, not further. Right here. And work on this corner. How you going to work? You're going to press with this, while this, again, the idea of the batteries. Very small area, very important. Your temporalis muscle connects there. And now let's go a little bit medial pterygoid. You're going to place your hand right here, right on the corner of your jaw. Here. And your hand, another hand, will walk upper teeth. I call this blade, because I really think it reminds me of the blade. And the muscle will live here. The muscle lives right. It lives here, and then it goes up to here. It's like a sling. But we can touch this part. So right here, we're gonna go. Oh, there is no more teeth. Oh, what is it? This is where we need to touch. By the way, if you have a strong jaw shift, this is the exercise for you. Exercises you can just spend more treatment time on the side that is feels tense, that is short. Work on your teeth. Find this blade. Both hands massaging. If you go too far, you will have this effect. So be careful with what you're this magic finger doing. It's just trying to find friends. It's just trying to find these two friends there. So don't really stress yourself like, oh, it's there. Medial pterygoid. Let's go. No comments, right? If you did everything correctly, you might be questioning a lot of things that you haven't done in your life, in your mouth, because those areas are really sensational. Second side, we're going to the lateral pterygoid, but for a second, stay, close your mouth, and feel if this jaw feels different. Of course, it might have like some inside painful sensation because you just touched it, but if it feels spatially different, should have more space. Let's go. Lateral pterygoid. Right here. Found it. You can shift your jaw to just understand where you shift to front. Yeah, that's a hood. Lower your head. Small circles. Shift your jaw forward and now like start, be more curious, massaging all of the jellyfish. I don't know, the jellyfish body. Left, right. Now find this, this is easy, right? Comparing to lateral pterygoid. Find this. Where is that corner? Where is like soft cheek becomes this. You're looking for this. And massage from two sides. Spoiler, the side that you have a bigger under eye bag will be more sensational in 75%. Oh, yeah. Medial. Walk, walk, walk. Meet the friends. Grind your teeth a little bit to understand where is it. I needed a little break. You grind your teeth and your muscle will be here. Again, don't get too crazy. It's already here. Everything's there. It's already, even if it's not a particular muscle fiber, it's already the fascia that the muscle in. This is amazing. Now the retest, you take your hand, you place it on your jaw, and you see, doesn't it not feel softer? Doesn't it not feel that you can go much deeper. Now, when your hands is very deep, you give half centimeter push for your upper hand, and you lower your jaw, and we stand here. By the way, make sure that your lip corner is slightly lip, so nothing like this happens. You know, smile, and then do it. Very good. Sweeping. Sweep, sweep, sweep. Second side. Oh, it feels like before it was old pillow that, you know, have some firmness and like you could like go there and it's so uncomfortable. And here it's like now it's like as softest newest pillows that nobody lay on before. What a magic. Lay and 1 centimeter push, half centimeter, with a smile of your face. Very good. Whew. Shake your hands. And now let's go into the lift that should be a little available. Even so, this was not now our real focus of the day, because the focus was under jaw. Pretty sure you all will see, even if in 30-40 minutes, the result of, you might even talk differently. But now you place your hands right here near the corner of the lips. Hug yourself, stay here. You are like hanging on the bone. And then softly remove your hand. You're just hanging. The mouth obviously attached area to your throat, all right? Through the buccal-pharyngeal fascia as well, and through the tension, right? The mouth goes inside. So now we are not moving the fluid, we are not ripping anything. Second time, please place your hands, could be a little higher, could be a little bit lower. This, no, but near the lips or a little higher, depends on your size. You found your cheekbones, you put them in your hand, and you lower your head. You wait. Imagine that your lips are magnets and they're trying to reach the floor. Lower your shoulders. Very good. Very, very good. Your jawline, your underjaw is saying thank you. Together with me, I'm saying thank you. If you felt that this lesson was challenging, it's because it was challenging and you did an amazing, amazing job. See you tomorrow.